Hello, people. Happy Tuesday, I think it is. Wanted to go through some of what I typically bring to work, and then, kind of clinical, I guess. I don't go to nursing school clinical, but I go to work. So I'll show you what's in my bag and what I talk about, some stuff I recommend having with clinicals. So here, let me turn it around. Let me show you Mac. He's going to be joining us. And this ridiculous amount of baby toys. OMG, guys. And then Tosh. Hey, Tosh. Hey. Hey, bud. So, yeah. All right, so this is my bag. This is my drink. You guys, if you don't know about these, you need to know about these. I love Dasani sparkling water. I love these. Delicious. No sugar. All right, so this is my work bag. Okay. So, I don't want to put this on the computer so I can be hands-free. Okay, let me have some of my Dasani sparkling water because OMG, guys. And it's the raspberry lemonade is the best flavor, if you ask me. Black cherry is the second. All right, guys. Let's talk about what I bring. Let's first talk stethoscope. Everybody, I'm sure you have a stethoscope, right? Shoot, let me get mine. All right. Stethoscope. I have a Littman. I recommend if you're in nursing school, okay, let me give you my stethoscope spiel here. Don't ever buy a $20 stethoscope. Those are crap. You might as well use one of those like isolation stethoscopes that are free at work. Those $20 stethoscopes suck and they're not worth it. So, but here's the thing. Don't buy a really expensive one in school either. Because if you do something like you work on a cardiac unit, or if you get a job in the NICU, like those are different stethoscopes. So I would wait to invest in a quality scope until you know where you're working. I have a Master Cardiology 3. Does it have it on there? It doesn't. See, I like this. I don't like where there's a bell on the other side, because I like to go like that. I don't know, it's a very picky thing. So I love to go like that. I also recommend, I haven't had time to have this one engraved, but my other one, oh, I have it. Hold on. Wait. Sorry, I'm leaving you. Hold on. All right. Sorry about that. This is my first one that I have. Oh, you might not be able to see it. Do you guys see this? Kind of. See where it says Kati Kleber, that K? So that's engraved. Highly recommend getting your scope engraved, because you know what happens is you think you're going to wear this all day, and then after about 6 hours, your neck starts to hurt, or if you're sweating, or if you had to run and this thing's banging on your chest, or if you're hot, it's irritating your neck, and you should not, I repeat, should not wear those covers. Those are very bad for infection control reasons, because if you think about it, if I have a cover on here, my husband just got home from work. So if you think about it, and you have a cover on here, and you're like listening to a patient, and this touches them, like I guarantee you don't wash those every shift, but you can clean this off. Oh wait, here, everybody say hi to John. Hey! Back from a long day at work. Welcome home. Dinner is on the stove. Yeah! Alright, so, I'm sorry. I get so distracted by John's handsomeness that I forget what I'm talking about. Alright, so, engraved. So, yeah. So you walk around all the time like this for hours on end, and then after a while you inevitably set it down. And then you forget about it, because maybe you did all your assessments for the day or whatever, and you forget about it. Or if you floated and you set it down and you forget about it, if you have your name on it, you might get it back. I can't tell you how many times I've left this thing on a different unit or in my unit, and someone sees, oh, this is Kleber's? Okay, and then they put it in my mailbox. Like, John been riding no, that's his plaid shirt. Someone said, has John been riding a horse all day? No. If you're talking about the way he's walking, it's because he's got a boot. And because he ruptured his Achilles. So he's walking kind of funny. Can you post a link to your brain sheets? Yes, I can't exit out of it. I can't do that right now. I will reply to that comment specifically and put the link there, but I can't do it right now. But I will. I will not forget about you, Jennifer. So I highly recommend. What's up in Oklahoma? Hello from Charlotte, North Carolina. So I highly recommend paying the money to get it engraved. Maybe wait until after nursing school. Like, this is what I think. You should get a mediocre, like, $40, $50 scope in school. And then when you get your first paycheck or when you get a little extra cash and you know where you're working, I would... Dubai? What? Hey, what's up? Oh, that's so cool. I love that. Someone just said hi from Dubai. Okay. And then later I'm going to say goodbye to Dubai. Okay, sorry. I'm sorry. That was a really corny joke. So I would buy a mediocre one in school. And then when you figure out where you're working, I would wait until you get some extra cash. And I'd buy a nicer one. I'd spend $100, maybe $200, depending upon the patient population you're working with, and get that name engraved on it. Australia? You guys, this is pretty cool. I am pretty impressed. The Philippines! You guys, we're international here. This is pretty cool. I like this. Oh my gosh, this is so cool. Scotland. I feel like you guys are messing with me. Are you guys messing with me? That you're all from all over the world? Well, I am truly honored to be talking to people all over the world right now. Don't make me nervous. I have a sip of my favorite drink here. All right, so that's my stethoscope spiel. So there's a couple of brands I want to talk about. Littman, Pennsylvania. What? My family is from Pennsylvania. Pittsburgh area. Okay. As you can tell, I like purple. I like the deep purple. Wow, really, in Australia? Y'all are killing me. Oh my god, I love it. Okay. Maine. Oh, jeez. You need to make like a map and like put a thing of where everyone is. You know, I wish we could do that. Say, okay. So, Littman is a great brand. Although in nursing school, I bought one with two tubes. Do you guys know what I mean when I say 2 tubes? So it looks like this. It's cheaper. Oh, Wyoming, what's up? Oh my god! You guys are so cool. Okay, so 2 tubes. And it was like light pink, but I feel like when there's 2 tubes connected, and those are the cheap ones, I feel like you can't hear as well. So I don't recommend those. I think I spent like $20 on one. I bought a $20 Littman. I don't know if they still make $20 Littmans. Don't spend don't spend $20. If you're gonna spend $20 on a Littman, I feel like it's like not worth it. So, but they do have $50, $60 ones. Heather joined. Heather Hawkins, what's up? NRSNG buddy that just had a baby. Heather, can you put the link? Jennifer earlier asked for the link to the brain sheets. And I don't want to forget that. So if you have a second, Heather, I would love it if you could post the link to the brain sheets. See? There's Heather. Okay. So, another good brand. If you don't want to do Littman, I recommend MDF. So M as in Mike, D as in Dave, and F as in Frank. MDF. Wonderful scopes. Actually, when I started working in neuro ICU, one of the nurses that worked, another one from Australia, Heather, you need to like scroll through, and we're just international right now. Dubai, Scotland, multiple people from Australia. It's pretty cool. Anyways, so when I started working in the neuro ICU, one of the nurses that have been working there for like 25 years or whatever, actually 3 of them that have been working there for decades all used MDF scopes. And that's the first I had heard of them, tried them out. The only thing I don't like, and this was also 3-4 years ago, they've probably updated them since, but they were a little heavy and the earpieces were a little uncomfortable, but I could hear really well. And they were like, I can't remember, they were 40, 50 bucks. I was like, this is a $50 stethoscope? Like, I couldn't believe the quality for the price. So, MDF is a great brand for stethoscopes, so I highly recommend those. Or Littman. I got a Littman that was 20 bucks. Like, don't get a $20 Littman. Don't do that. Any tips on how to listen to heart sounds with a regular stethoscope? You know, so this might seem silly, and maybe I just want to make sure. I'm someone that's like, tell me all the obvious things. Like, don't assume I know anything. So, do you see this? It's clicking. It turns. If it is turned the wrong way, you can't hear anything, or you can't hear very well. So, if you can't hear, you put it on someone's chest and you can't hear, turn it, and then see if you can hear it. And this is my older scope. The other scope I have now doesn't do that. This more expensive one, it doesn't do that. But I would always have to do that. I'd be like, wait, why the hell can't I hear anything? Oh, wait, and then, like, I remember the first few times I didn't know that. I'm like, what is wrong with this? And I pretended like I could hear them to the patient because I didn't want to look like an idiot. And then later I figured it out, so then I had to go back. I was like, I'm just going to go ahead and do another assessment real quick. When it was because I didn't hear them in the first place. All right, that's scopes. Stethoscopes. Heart sounds. I think we have a really good post on heart sounds. Oh, hang on to heart sounds. I'm going to go back to that, but hang on it. Okay, another thing. Water bottle. Always have a water bottle. Don't use styrofoam cups every day, people. Don't do it. Bring your own water bottle and reuse it and stay, hydrated. Somebody said you look like you got off of a horse.
What does that mean?
Well, you can't see your boot, but you can just see you walking funny. So I had to tell him about your Achilles.
Just tell him that's my walk.
That's just how John walks. Okay, what kind of flow sheets do you use? I use something very specific for neuro ICU, but if you go to brainsheets.com, there's like 30 some. Neuro ICU peds nurses are amazing. Could care of my baby after brain cancer. Oh, your baby had brain cancer. Number 1, peds nurses are amazing. Number 2, my heart goes out. Your baby had brain cancer. Oh, yeah. Oh, okay. Have I ever tried an ultrascope? No, I have not. I honestly don't know what that is. Okay, so water bottle. I love this one. Nalgene. I love this thing. $10 on Amazon. All right, but this is the main thing that I have. I call it my nurse purse. Got this on Etsy. If you search, there's Etsy. There's like $30 or something. I'm sure if you could sew, you could probably make one of these. I don't know, but I like the size of it because actually, if I fold it in half and if I didn't have so much crap in it, I really could fit this in my scrub pocket. Like if I folded it in half, which I used to do. So what I do is I put a bunch of stuff in it, and I put this at the nurse's station. So I put this in my bag, in my locker, and lock up, like my wallet and stuff. And then I put this as the nurse's station. This has all my goodies. I'll go through my goodies. All right, I got my badge in here, Okay, so one thing I have. Where is it? I kind of have an order I want to go through. So I have an extra badge reel. I don't know if you guys have ever pulled on this a little too hard, or screwed it and like broke your badge reel at work. I have done that once before, not with this brand, but I always like to have an extra badge reel. I love these badge reels. I'm a neuro nurse. Look at Betty the Brain. How cute is she? Etsy.com, badge balloons, made by a nurse. Those are all my badge reels. Okay. Snackies. Okay. I always have these just in case I don't have time to get a snack and I start feeling like woozy, which has happened. Also, highly recommend that as a nursing student. I can't tell you how many nursing students I've seen pass out over the years. Not because what they're doing is so terrifying, but you know, you get all worked up and then you're like, oh, I'm not hungry. I'm so nervous. My husband just accidentally called me. I was like, what was that? Okay. I thought I might lose you guys. Okay. So I've seen lots of nursing students pass out. So what they do is you get all nerved up. You don't eat breakfast because you're so nervous and you're so wired and you're like, I can't eat anything. And then you get there and then someone gets stuck with a needle and blood and people pass out or they're just so worked out. So I always have a snack. Oh, and another thing too, in nursing school, I don't know about you guys, but I've had this where we're doing our normal clinical and they're like, hey, does someone want to go shadow in the OR? See, okay, Lisa Scott, she is a nursing professor, y'all. She would know too about the passing out thing. I swear, like I was in school and I saw it, and then I have had a lot of nursing students over the years, and it's like every year or every group, one of y'all passes out. That's okay. No big deal. It's fine. You're surrounded by a bunch of nurses. That's okay. But, so what would happen frequently for me, at least in clinical, is we'd be doing our normal clinical thing. And then someone would, oh, hey, we have an opportunity for someone to go shadow in the OR, or not shadow, I guess just observe in the OR. It's like, oh my God, that's so cool. I want to go. But it's like, if you want to go, you got to go now. Like, there's like a time window when you can go do this. You can't like go to the break room, get out your lunch, heat it up. Because if you go to the OR, your butt better eat before you go to the OR, because you're going to be standing there. And if you pass out, there's not people to like, you know, I mean, they'll take care of you, but they no, it's not the same as on the floor. You can't, don't pass out on the OR. So, and that also happens. I'm saying this because it happens. So anyways, make sure, I just like to have a snack on hand. So if someone says, hey, you want to go to the OR? It's like, yeah, let me, and then you like shove this thing down your mouth as you're getting on the elevator. So you've got something in your stomach before you go in the OR, and Lord knows how long you're going to stand there. I've seen 2 surgeries. I saw tonsils and adenoids on a little kid. And then I saw a neurosurgeon clip an aneurysm, which was the coolest thing ever. Oh, wait, hold on. Also, practice wearing a surgical mask. Wearing it in the OR the first time can make you lightheaded. Breathing into it. What a wonderful suggestion. I love that. That's true. That is very true. Any tips on how to improve grades in health assessment courses? My phone's ringing. Hey, don't make fun of me because I have a landline. I know y'all probably don't have a landline, but my old self does. Hold on, let me make it stop ringing. Okay. OMG. Anyways, any tips on improving grades in health assessment course? Let me get back to that, because I could talk on that for a little while and then I'll forget what I'm talking about here, but I'll get back to that. And then if someone else has a little something they can help, please feel free to put that in there. I was so close to going to the OR today for a stage 4 sacral ulcer debridement. Oh, that would have been so cool to watch. Thank you, Lisa. Practice, practice, practice. Love it. Yes. And assess your friends, your parents, like, and oh, hey, Heather, I'm pretty sure we had a video about me going through an assessment a couple weeks ago. Can you put the link to that? Any tips on peds? I'm gonna be honest, guys, no. I haven't dealt with peds since school, and peds, no, I don't know anything about children except I have an infant, and I feel like, I said this to my friend today, I feel like I don't know much with Hannah because I'm like learning it as I need to. Like, I feel like a brand new teacher, their first year out of school, like, I just got to stay one lesson ahead of the kids. Like, I got to stay one developmental stage ahead of Hannah. Okay. Oh, starting our pharmacology placements next week. Wonderful. We have our MedMaster course. That's wonderful. Okay. Sorry. There's so many comments. Okay. Let me get back to this and then I'll go through comments because I'm gonna forget what I'm talking about. Okay, so nurse purse, RN purse, Etsy, got this. I love this because I really like this because when I float, I can take this with me and I have everything I need with me, but I don't have like my wallet in there, so I don't have to worry about, like, if I left this in their unit and forgot about it, like, it's not the end of the world. That's John taking off his boot. Okay. Tide pen. Yeah, I mean, yeah. Couple good pens, a pencil. Sometimes I like to write a pencil. I like the switch double. Sometimes I like to get fancy and highlight. I like to, have that option. Like, I don't, like, always want to do it, but I like to have the option. All right, so I love this pen. Nurse.com. I got this at Magnet like a year or two ago, and this bad boy. I love this pen. So I have a couple good pens that I really like. Gotta have a Sharpie. For writing on lab labels and dressings. Some people, one of my coworkers has this and I love it. It's the little tiny one that's on the badge. I love that. Oh, and while I'm holding my badge, I got my pen light. Oh, that was kind of, So yeah, they don't make this anymore. So don't ask me where this is from. It's Cherokee, but they don't make it anymore. They should, because this is wonderful, because I always have my pen light with me and it's lightweight and it doesn't weigh it down. It's wonderful, but they don't make it anymore. So don't ask me, because every time I show that, 20 people ask me where to get it and I have to be like, sorry, they don't make it anymore. But they don't make it anymore. Okay. Lemon essential oils. Bear with me. When I was pregnant, I was nauseous all the time. And a little whiff of this would keep it at bay for a little while. And I've kept it in there because sometimes you walk into a room or a situation with a smell that's really hard to unsmell. Because it's not like there's fresh air in the hospital, It's like, to get fresh air, I'm going to go take an elevator down 6 floors and walk half the length of the, So it's nice to be able to crack this bad boy open and fresh lemon. Now I don't smell feces, right? Okay, so not a must-have, but it's a nice little thing to have. Another thing I have is, and I wrote my name on it because nobody's stealing this because this is mine. Honest Healing Balm. It's like $10. It's from the Honest Company and I love it. It's like this organic-y, oily thing. Not oils, but and I use it on my dry knuckles, especially after washing your hands so much. These are nice. All right, a couple tea bags because sometimes I like to have tea, right? You got hot water. Why not? Okay. Have a couple of tea bags. I have, I don't always wear a watch, but I like the option. So or like I'll start off wearing it and then it'll make me mad and I'll take it off and I'll put it in here. So I just kind of keep it in there. And then let's see. I have a couple lip balm options. One with color, one without. Depends on how sassy I'm feeling, Backup contacts, hair tie, duh. Backup hair tie. Who wants to snap the hair tie? Scissors. Although usually I don't use these. These are like opening a medication scissors in the med room, or like I don't take these into patient rooms. If I need scissors for a patient, I get out a fresh pair of scissors and I leave it in the patient room just because of like cross contamination. And then last but not least, my scrub sheets. So it's that length that I have in there. I love these things. And I'm an experienced nurse now and I like them. It's not just nursing school. And I'll show you the rest of them. But scrub sheets is like, it's like $35 or $40. And you get 48 laminated full color cards. I have the neuro ones because I think they're great to educate patients on. Like, you got your cerebral vasculature. I like this, pictures of the brain. Where was your stroke? Your stroke was in the parietal lobe. Well, where is the parietal lobe? We'll over show you. So that is really helpful. All of you NIS certified nurses, Mama, Tip Top, 50/50 Huckleberry. If you don't know what that is, look it different kinds of seizures. So I like having like my neuro ones with me. And then I like this one. So this, did I write that down? Hemodynamic basics. Sometimes, you know, you're going real, like, you know, you're a little on autopilot. And it's like, sometimes I'm like, wait, okay, I want to make sure what's normal stroke volume? Wait, what is normal cardiac output? And then this differentiates preload, contractility, and afterload, which, you know, if you have a critically ill patient and their blood pressure's low, you know, you don't just put on vasopressors. Like, that might not be the issue. You know, they may need more, their preload may need to be optimized. And, you know, giving them vasopressors isn't going to help. I mean, it will, but it's not really fixing the problem. They need fluids, they're dry, you know. Or maybe they have enough fluids, but the pump isn't working. So we got to work on contractility. And so I like this card because is it backwards? It's probably backwards. So, because it breaks up the 3. So I like that one. So I keep these with me, but it comes with, this is a little, so when you buy it, this is what it comes with. I don't have them in order, and I wish I did, but oh yeah, I wanted to talk about the heart sounds. Bear with me. Comes with a little ring. And this is, okay, so they're $35-$40. Sounds like a lot of money, but honestly, you know what it costs to print full color and laminate 2 sides? It is not cheap. So if you wanted to go do this, you're gonna be spending that much money anyway. You know what I mean? So like, because I originally thought they were a lot, and then I'm like, wait a sec, like this would be expensive to do. So anyways, so they're for different areas. So like there's a pediatric one. In nursing school, that would be very helpful, but for me, working with adults, it's not, like, I don't need that. And this is why I love these. In nursing school, okay, so wait, here you go. What makes a mark of a good nurse is not knowing everything, right? It's not realistic for you to memorize this. Or if you get out all your textbooks, that's not realistic to memorize that. And the best nurses on the unit aren't the ones that know everything. They're the ones that know how to utilize their resources. And that means, okay, no, I don't know the answer, but I'm going to find it out. Like, that's the mark of a good nurse. And the wonderful thing is, you know, a lot of clinical instructors, they either do or don't let you use your phone, which is fine, you know, whatever. But a lot of you, even if they do let you use your phone to, like, use clinical apps and stuff, they don't let you use them in front of the patient, which makes sense. I don't think you should be using your phone in front of the patient either. But when do they ask you questions? When you're in the room in front of the patient, like, looking like an idiot, like, I don't know. So that's why I really like these, because I'm not wearing scrubs right now, but they fit in a scrub pocket. And I actually tried them on a couple different scrubs that I have, because some have smaller pockets than others, but these fit in normal scrub pockets. But, you know, I don't know all of the information on these, but I know where to look when I need that information. Example, if I'm in my pediatric clinical, if I'm in my labor and delivery clinical and someone just had a baby, and this actually happened to me, now that I think about it. Woman gave birth, which, oh my God, I can't believe I saw that, like, and actually, when I watched it, I was with one of the few guys in our class. He watched it too, and he was so pale. I thought I was gonna have to, like, hold him up. Like, I thought that guy was gonna hit the deck. He didn't, but he almost did. I was a little, like, as well. But anyways, I've since had a child myself. Anyways. So, but you know, it's like, you're in that situation where you have whatever in front of you, and they're like, hey, how many arteries and veins are in the umbilical cord? I don't know that. I do now. But, like, if I don't know that, oh, wait, I think I have a scrub. Wait a sec. Like, let me look here. Oh, wait, on here, 1 vein and 2 arteries. Like, you know, so it's like, oh, wait, I don't know, but let me look it up real quick. The pet peeve when I had nursing students, or when my colleagues have had nursing students, is when I ask you a question and you don't know, but you go find out the answer and it takes you 30 minutes. Like, okay, like, if you would have just, like, don't go slowly walk to the nurse's station, slowly open your textbook, slowly Google something or whatever, like, The quicker we get through this, the better. Like, let me know, you know, your question, or let me know if you know how to find the answer. If you don't, let's get through, because like that 30 minutes, we could have been on to the next thing, if that makes sense. So it's great to be able to utilize your resources and know your resources. And that doesn't mean knowing everything on your resources. That means knowing how to navigate them, if that makes sense. All right. So that's my stuff. So like I said, I only have a few of them with me because working in such a specialized area right now, only some of them are applicable, but in nursing school, these are wonderful. So scrub sheets, and I think somebody put links for me. I think Heather did. Hold on, I gotta show you guys this. Look at all this crap. Oh, look at that Mac. All right. And that husband. He hates it. He hates that. That's okay. I understand. Okay. Now I'm going to go work through the questions. Okay. Practice, practice, practice. Thank you, Lisa. Oh, heart sounds. I forgot about that. One of these, I don't want to find it right now, but one of these has heart sound locations on it, which is wonderful if you forget. Because truly, if you listen in the right spot, you will hear it much better. There's quite a difference if you're not where you need to be. So, and I don't know if Heather's still on. If you can put up the link to the cheat sheet about our heart sounds, that would be helpful. Also, don't listen over clothes. Make sure you get under clothes. All right, and I'm going to say this in the most politically correct way. If you have an overweight man or woman and they have breast tissue, you better pick that up and get where you need to go. Don't try to listen to their heart. Like, truly, pick up and go where you need to go, okay? I know you probably never thought in your life you'd have to pick up somebody else's breast to do anything, but sometimes you need to. And this is also different. Skin under there can break down, and it's important to assess that and making sure that is not breaking down, and if you need to put something there to make sure that it can absorb some moisture, like, yeah. So make sure you're moving those if you need to, and if you feel weird, my suggestion is to just treat it like all business, nothing personal. Here, I'm going to lift you up right here so I can take a listen. Sorry about that. Like, just do it in a real professional way, like not in a, like, the more confident you are, the better, you know, because it's important. You have to be able to hear. And if you need to move things, move things. Okay, I think I said that the most politically correct way. All right. New nursing student, any advice? Hey, we have tons of posts. Check out the NRSNG blog. We have tons and tons of posts. And actually, we just did a really good master post about like everything you need to know going into nursing school and stuff. So check out our blog. We have a lot of great stuff. Loved assessment class. Wonderful. Okay. No. Oh, okay. So if you want to, someone asked about assessments, go ahead and check out the videos tab. New nurse, any advice? I need a job. Oh, girl. Yeah. It's a tough market out there. We have a lot of posts about like getting a job, interviews. I also have my own blog, nurseirole.com, where I have some posts about interviews and getting a job. Nursecode.com has great blog posts about getting a job. I don't know what a pharmacology placement is. Maybe you're following pharmacy. Hello, Richard. Thank you, Lisa, for the shout out. I love it. Okay. All right. Do you suggest UWorld? Okay, so I've tried UWorld before. UWorld is an NCLEX test bank thing. I tried it. I didn't use it for my NCLEX personally, but I did a review for it on my Nurse iRoll blog. So if you go to Nurse iRoll and check out UWorld over there, I have a review about it. But us at NRSNG, we started nursingpracticequestions.com, which is like UWorld but offers a little bit more. And I don't know how they compare price-wise. Check out nursepracticequestions.com. I haven't looked at UWorld for a long time, so I don't know if I can really accurately speak to them. I do know it is a question bank, and that's about all it is. All right. I like the oil. Thanks for the shout out. Okay. Recent new grad to a med-surg floor. Any tips on staying organized and keeping what everyone needs in order? I get overwhelmed trying to keep in mind who needs what, and it seems like my preceptor just knows everything, what everyone needs right away. Yes, so that'll get easier with time. The more experience you'll have, the more you'll be able to predict stuff. Like, something I do now that I didn't do at the beginning is whenever I'm rounding in the morning and meeting everybody for the first time, I'm assessing their pain level and checking to see if they had a pain pill recently, because if they can have a pain med and they're hurting, I'll say, hey, mind if I bring that in with your morning meds in a little bit? Yes, great. Like, it's like something that you can do ahead of time. So it's staying organized. Don't take the, like, I'm trying to think. I don't want to say. So I use your brain sheet. And write down things as you need them. You'll figure out your own like style. I encourage you to consolidate trips into rooms. Try and think, what can I consolidate? Okay, so I'm going in to do a bed bath. Is there anything else that the patient needs right now? Or is there anything else in the next hour that I can do that I can bring to this trip into the room? Decrease the amounts of trips into the room as much as you can. That's going to save you time. Consolidating tasks. When you're charting, making sure you don't try to sit down and chart the whole thing. Like, chart by exception. When you get a second to chart the odd things, the different things, and then when you have time, go back in and fill in the normal stuff that you chart on everybody. It'll take time, but you'll get used to it. You will get used to kind of normal things. Okay, I'm leaving the room to go grab them some ice. Hey, can I get you a warm blanket too? Would you like one? Oh yeah, I'd love a warm blanket. That sounds great. Like, especially also with physicians, you'll get used to the physicians and what they like to order in various situations. So truly it's experience and getting used to it. So just know that you're not like off. Like, if you're just starting out, it takes a while to develop that. I promise it'll get easier. Because I think you walk in thinking I'm going to be as great as the preceptor pretty quickly, but it takes time, and there's a lot that you have to like learn and figure out on the way. Okay, great. I'm an RN. Never leave scissors in a patient's room. All right. Any advice for newbie nurses and advice for some rude nurses and doctors? Can you download the scrub sheets? We cannot. I think it's just a physical product. I don't think there's a PDF you can download. Let's see. Any advice for newbie nurses? We have a lot of great blog posts. Please check out the NRSNG blog. Rude nurses and doctors. Yes. All of you are probably going to deal with rude nurses and doctors. Number one, no one deserves to, you do not, under any circumstances, regardless of what you did or didn't do, no one should speak to you disrespectfully, and sometimes you have to stand up for yourself. Like, I am a professional, and when you can talk to me on the way the professionals need to talk to each other, then I'll get back to you. But we can talk again, but we're not going to talk while you're like talking like that. Or pushing back, like, don't just let people just talk to you like rudely. Standing your ground is really important. And it gets easier the more you're familiar with processes and stuff. But if someone's getting rude and loud, stop them. You are not going to speak to me like that. It's a good one. I've been yelled at before and didn't know how to take it or deal with it. And then I figured out that it's like, no, you're not going to talk to me like that. So I think part of it is just being empowered to know that, hey, you don't got to be disrespectful back to them. Just say, hey, you're not going to talk to me like that. Whenever you're ready to talk like professionals, let me know. Click or walk away or whatever. That's really important. Just dealing with rude people kind of sucks. I think it's important to stand your ground and not let people speak to you disrespectfully, I guess. I graduate next month, And in clinical, I still don't have to have a good rhythm down. My instructor wants us to have a lot of information before even giving morning meds, yet nurse I'm following is not going to get behind for the day, waiting for me to write a book on the chart. Yeah. That's tough. It's tough. There is a lot of information to know. I encourage you, especially if you're getting report with the oncoming nurse, to really pay attention to what they're paying attention to. When you're in nursing school, it's kind of hard to, like, when you get a report, to pick out the important stuff. You know, and there are so many things to know and things they can quiz you on, but if throughout the shift, if you can kind of chat with that nurse, it's like, hey, when you're getting a report, I know you're not writing every little thing down, but what's important? Like, what are you picking out that's important? Let's see. Yeah, it's hard to predict. I remember times where it was like I just couldn't win with some instructors or clinical instructors where I felt like no matter what, I didn't have the right information. And yeah, it doesn't make sense for you to write down a book, but also, you know, using the line like, hey, I don't know that, but let me look that up real quick. And then being able to navigate the chart to find it. It's hard to have, you know, it's not realistic for you as a nursing student to walk in and know everything about that patient off the top of your head. Like, I'm a nurse and I don't know that. Like, I don't know everything about my patient, but I know how to look it up and I know kind of some important things. But, you know, knowing that they had knee surgery 17 years ago and that kind of stuff, it's, I think knowing where to focus. So really focus, I think, on report. When it really helpful if you can observe that oncoming nurse getting report, seeing what they're writing down, and if you have a second, talking to them about why they're writing it down. Because yeah, it's not really realistic to expect that nurse to stop and explain everything and get super behind. Okay, yeah. Okay. Nursing student, I have a clinical purse. Best thing, I have everything I need. Great idea about the tea bags. Yes. I learned that like a couple years ago, and this nurse was like, who's worked there for like 30 years, always brought tea because he didn't like coffee. And I'm like, oh, that's so smart. Like, I love tea. I don't know if we ship to Canada. That's a great question. I don't know. They're on Amazon if that helps. Guys, scrub sheets, if you go to just scrubsheets.com, it will automatically direct you to where you can buy it on Amazon. I'm loving all these questions, guys. I got my nurse purse on Etsy. If you search RN purse, it's a nurse that makes these, which is another reason I like them. And then a portion of the proceeds go to March of Dimes, which I think is pretty cool. So, yeah, nurse purse on Etsy. Oh, no, we don't ship to Canada. Okay. Hi, Lisa and Tina. Etsy.com, and the shop is RN purse. So if you're in clinicals and you have time to... Oh, wait. If you are in clinical and you have time to sit around and drink tea, then you are choosing to not make the most of your clinical time. So your instructor should never allow that either. Okay, Summer, let me just let you know. I have tea in my little thing because I like to drink tea at work sometimes. I like to drink fluids like any person or have a warm drink in the nurse's station. So this is I'm not talking like I just got out of nursing school clinical. I've been a nurse 6 years, and this is what I pulled out of my work bag with my tea bag. So I enjoy tea at work. Yeah, and you get a lunch break. If you want to have tea on your lunch break at clinical, enjoy it. And afterwards, that's something too, like whenever I would have working in the middle of the night and I had a little bit of time, or if I had lunch, I love to have tea with my lunch. All right, everybody. Meds, I still don't have them now. Meds are tough. Our Med Master course is wonderful. We also have a drug card template, which is really nice. So you can just plug in the information and you don't have to recreate a template. We have it. I think it's NRSNG.com/drug card template, I believe. Heart murmur guide. Thank you. I got my scope. Oh man, I got it so long ago. I don't remember. Some online store. I mean, it was just a Lippmann. Like, I don't remember. I think it was at a local scrub shop in my hometown. Yes, I've heard good things about UWorld. Yeah. So, different pen color, that's a great idea. I used to do that where I would have a red pen and a black pen, and I had them taped together with nursing tape like that. So then it was like, I would write down report in black pen, and then all day. And then I would do my tele strips and any like official documentation in black pen. But then if I changed anything, I would write it in red pen, so that when I was giving report to the oncoming nurse at the end of the day, I had all of my old information was in black and my new information was in red. I did that on the floor when I had like 4, 5, 6 patients. But when I was working in the neuro ICU, I didn't feel the need to do that with 2 patients because I could remember pretty well. Best advice for a freshman nursing student. Whew. Hang in there. Stay organized. Be smart with your time. We just did a really good post on that. On staying prepared. Or wait, I think it's called So You Want to Go to Nursing School or something like that. And there's a lot of really good advice in there, and I want to encourage you to check that out. How many of the weeks do you have clinical? So, it's been a long time since I have gone to clinical, but when I was in nursing school, it was 2 days a week. And then when I was a senior, second semester, I had a certain amount of hours I had to get done, and it was up to me to get them done however much I wanted to. I think I had Tuesdays and Thursdays off, so I would do 12 hours, and then I did a bunch of a weekend, so I got them done kind of early. But I think during most of school it was Tuesdays and Thursdays, and then I would have class Monday, Wednesday, Friday. But I also went to nursing school 7 years ago, so I don't know if that's right. Oh yes, don't forget to ask your patient why they're in the hospital. That's my assessment questions, and I don't care how alert you are and how fine you think you seem. Tell me your name, tell me the month and the year. And if you want to get fancy, you can tell me the day, but I can't remember the day half the time, so I don't ask them that. Where are you? First I ask, where are you right now? And then hopefully they'll say the hospital. And then, do you remember why you're in the hospital? And then I go into my education. That way I can do a very specific neuro exam. One time I had a patient was totally fine, like chatting just like we're chatting right now. And then I was like, oh crap, I didn't, and I was like, they're fine. I don't need to ask those questions. But then I thought to myself, no, I'll go ahead and ask him. And I asked him like the year, thought it was 1977 or something like that. And, and sometimes I'll ask, who's the president? Actually, I stopped asking who the president is because people go off on these like political rants that I'm just like not in the mood to deal with. So I actually stopped asking who the president is. But that was back when I asked, and I can't remember what he said. Someone that didn't align with the year. I don't know, like he said like FDR. I don't know, something crazy. But he seemed totally fine. So always ask your orientation questions, even if they seem totally fine and you feel ridiculous asking them. I always say like, just humor me. Tell me your name. Tell me where, but they're usually pretty fine because you're asking them that when you give them meds anyway. Hello, Joyce. 2 of my classmates did UWorld after their first attempt at NCLEX and passed it. Wonderful. Lab values, yes. Freshmen, oh, I see what you're saying. Pay attention to lab values for freshmen. Yes, and actually one of these has lab values on it. I personally, as a bedside nurse, don't carry the one that has lab values with me because when I go into the chart, because we have electronic charting, if I pull, I know a decent amount at this point off the top of my head, but for the ones that I don't know off the top of my head, the reference range that we go by is actually right next to the lab value in the computer. So that's why I don't carry it around with me. But if I was a nursing student, I would absolutely carry the one around that has the lab values. Where did you go to school? I went to school at Iowa Wesleyan College. It is now Iowa Wesleyan University, and that is in Mount Pleasant, Iowa. And I did my BSN there, but I did my prereqs at Parkland College in Champaign, Illinois. How hard is the nursing? Yes. What was your first nursing job? Do you recommend med-surg for a new RN, or is it okay to specialize as a new grad? I keep hearing different things from instructors at my school. Yeah, you will hear different things from people. So I started out on a cardiovascular and thoracic, like, surgical step-down unit. So patients that had cardiac surgery after they got out of the ICU, they came to us until discharge. So it wasn't quite a floor. It wasn't an official step-down unit where we took art lines and stuff, but it was like kind of in the middle ground, with pretty decent cardiac patients. But you will hear, I've noticed, you hear different things. And I don't think there's a perfect right answer. There's some people that feel very passionate about nurses all having med-surg experience before they go into their specialty. There are some that say, go straight into your specialty, and, So there's pros and cons on both sides. If you know through and through that you're a NICU nurse and you want to work in the NICU the rest of your life, I don't know if working on a med-surg floor, and you can get a NICU job right out of school, I don't know if I would pass that NICU job off to go work on a med-surg unit for 2 years. However, that is not the case. Most people can't get their dream job right off the bat because maybe they're not hiring new grads, or maybe it's pretty overwhelming. I love the neuro ICU, but I would not have made it in the neuro ICU as a new grad. I wouldn't, and I haven't seen too many that have. The ones that I have seen make it are ones that worked on our unit during nursing school that were friggin' rock stars. But I would not, I had to learn how to be not a basic nurse. I had to learn how to learn the basics of nursing, how to get good at time management, how to get good at dropping Dob-Hoffs, starting IVs, phlebotomy. I wanted to learn how to do that kind of stuff and manage time and get better at talking to patients and educating patients and working with physicians before stepping up and going to that ICU where people are dying. People are end-of-life conversations. Patients, families are asking really important, difficult questions that they need answers to, but I didn't feel equipped to answer. I would not have been a new grad that would have done well in ICU straight out of school. I know a few that have done wonderful, but it's not, I feel like the people that excel at the ICU level right out of school are the exception and not really the rule. I feel like most people, it is really good to get some med-surg experience that is invaluable. But if you got your dream job in front of you, I don't know if I would pass that up to do med-surg. You know what I mean? So there's not a specific right answer. There are people that feel passionate about both sides. I'm a little bit in the middle. I feel like you can have things that work out both ways, but having that experience at the bedside on this step-down unit and floating to the regular nursing floors was essential to my development as a nurse. I think I would have lost my mind and quit if I had started in the neuro ICU. Definitely, I would have. I know I would have, and moved into units. And when I was when I was a brand new nurse, there was a girl that had started in one of the ICUs, and a couple weeks into it said, "This is too much. I can't do this." And then she came to our unit and did wonderful. She's a nurse practitioner now. It's like, this sounded great, but getting into it, I don't want to do this. And there's no shame in that. And that's the thing too. If you think you want to be in a specific field of nursing and you get into it and you're there for a couple of years and you hate it, you've really narrowed your focus, right? Going from working with maybe labor and delivery or women or whatever, or maybe psych. You go into psych as a new grad. That's very specific, very specific. So if you decide, hey, psych's not for me, I want to go work in med-surg, or I want to work in the float pool, or I want to work in the ICU, you're going to feel like you're starting as a new grad again because the care is so different. And you may miss out on a new grad residency program, which I think are really important. So that's something to think of, because if you get general med-surg experience, that can really translate to a lot of positions, but a lot of other positions don't necessarily translate back, if that makes sense. That was a long-winded answer. I'm sorry. Oh, different between abnormal... I don't know that neutrophils question. If somebody knows the answer, please put it, but I don't know it. One more question. I'm loving these questions, by the way, guys. Thanks. I want to do trauma, ICU, or OR. I want to get an internship at JPS, which trains you in different areas. As a backup, if I don't get accepted anywhere else, I should try to get a job. I don't know if you mean hospitals or specialties. Yeah, so trauma, ICU, or the OR. Word of caution, OR is it's kind of like, it's very, very specialized. Like, you will learn how to be an OR nurse, but then if you decide you don't like working in the OR, like, it's very different than working on the floor. So just keep that in mind. The learning curve is very different. Like, you know, you're going to learn how to do an OR nurse stuff, and it's going to be very challenging. And then if you decide, hey, I don't like that, I want to go there, like, that's going to be, like, so just keep that in mind. If I don't get accepted at that, I don't know if you mean hospital or a different, specialty. Those are all great. I mean, step downs are wonderful too if you don't get a job there. But you know, if you don't get a job in a hospital, and I've had that question a lot, like, hey, I applied at this hospital I want to work at and I didn't get there. Hospice centers are great. Skilled nursing facilities are great. Get some experience and some recommendations. Those are really helpful. What else? Dialysis units. People kind of hate on those, but I mean, I don't know about y'all, but have you ever seen somebody get dialysis? Like, that's not this easy thing to do. Like, you're, like, legit, like, working with very complicated stuff. So, you know, there's options out there. And then there's always stuff like psych and whatnot. Okay. I gave my 2 weeks notice at my first nursing job after only 2 months because I was instructed to give insulin and meds by memory because the computer was down and they didn't have orders. The patient had different amounts at different times of day and I refused to do that. I feel so upset. My question is, should I explain why I gave notice so soon to future interviews? If you only worked there for 2 months... See, that's a good question. I don't know if anyone else out there has any specific advice about that one. They may ask you. If they ask, I would definitely explain it. I don't know what the minimum amount of time you have to work somewhere, though, to put it on your resume. Like, if you work somewhere for, like, a little while, I don't know if you have to put that on your resume. Yeah, I honestly, Jay, I don't know how to answer that, but kudos to you for getting out of there, because that doesn't sound like a safe environment, because I would have said no to. ATI. Oh, ATI is something else, y'all. I did not like doing ATI. Oh, Mount Pleasant is beautiful. You stick the Amtrak and it goes by there. Oh, yeah, woohoo. Love your chats. Thanks, Stephanie. I have no idea where, I did my final placement in a small town emergency department in Mount Pleasant, Iowa. And I liked it and stuff, but when I graduated school, I didn't know where I wanted to work, and I was like, you know what? Wherever I get a job, I'm gonna work. And then I got an offer for a general med-surg, and then this cardiac step-down, and I went with the cardiac step-down, and I really liked it. So, and then I worked there for 2 years, and I've been in neuro ICU for 4, and I love it. I love brains, critical care, and geriatrics. I never thought I would. Have I ever worked in the L&D or ER? So I've never worked in L&D, but I was just in L&D as a patient. Man, y'all, that is no joke. I mean, labor and delivery, I felt like being a critical care nurse. When you have patients that are in labor, like, I felt like that was a critical care environment. Like, very challenging, acute situations, elbow to elbow with the doctors. Like, that's an intense environment, and I could see it being very rewarding. I could also see it being very painful and difficult with difficult childbirths. A lot of pain management going on, a lot of education and coaching when people are in, like, horrific pain. ER, I haven't, like, I'm kind of, with ER, I did internship there, and I volunteered in an ER. Decided I didn't really want to go there. I didn't want to do that. I did enjoy, like, the trouble with the ER, right, you got the patients that really need to be there, like that small amount that truly need to be there, and then you have that large amount of people that don't need to be there. That it's challenging to, like, kind of deal with that stuff when you truly have people dying in their rooms next to each other, and you just got a lot going on, and it's so unpredictable. Some people love that and are wonderful with that, but it's just not my thing. But I respect the people that do that, and I know a lot of people that love it. Like, they'll never work anywhere else but the ER. And so I think if you have the opportunity to get into those areas as a student and just kind of check things out, I highly recommend that, because I wouldn't ever recommend going into either of those areas without having some understanding about how it flows, if that makes sense. Okay, did you feel ready to go once you graduated, or did you feel like you had to learn a lot? You learn a lot. Like, you feel like you know nothing when you become a new nurse, because nursing school teaches you very generally. Like, this is the whole field of nursing, and that's a really big field, and it's huge. Like, nursing school is so general because it kind of has to be. That's okay. And then you get to your job, and it's painfully specific. Like, this is what you need to learn how to do to function every day. So you feel like you're starting all over because you learned the big generals, and now you're going to the very, very specifics. So the first year of nursing can be very difficult and challenging. So check out my blog and the NRSNG blog. We've got a lot of posts just to support you through that because it's so challenging. But I felt like I learned a ton in orientation, a ton in my new grad residency, and I felt like I knew what I felt ready to come off orientation, but I still didn't feel like I could handle it all myself. Like, I had to really lean on my resources a lot, my coworkers. So yeah, probably not the answer you're hoping for. All right, Natalie, pre-nursing student. Oh, and applying to getting in. Okay, Natalie, I want you to go to that blog post, How Hard is Nursing School? There is a link to it in these comments above this. And we talk about applying to getting into nursing school. I graduate in May. Congratulations. Currently have clinicals at JPS. I love it. Wonderful. What if you start off in the ER? Would the transition to a floor be okay? Yeah, I think so. The time management from the ED to the floor is totally different. Totally different. But you will learn that. That is, if you can manage your time in the ED, you can figure that out on the floor. The ED is very focused assessments, in and out, very like, what is the problem? We treat the problem, but then when you get to the floor, it's a little different. It's not, you're doing it's not the focused assessment, it's the head-to-toe assessment, and it's the kind of more long-term management of things. So your mindset has to change a little bit, but you can totally go there's a learning curve to both. If you go from the ED to the floor, or to the floor to the ED, learning curve to both, but totally doable. And wonderful if you have experience in one of them first, if that makes sense. It'll make that transition easier than like starting off as a new grad. So, yeah. Hi, Chris. First semester nursing student, great in clinical, but struggling with tests. Wonderful doing. So here's my thing. You can study really hard and be good at that, but it's really hard to, being good in clinical is wonderful because it's hard to teach someone to be good with patients and putting those pieces together. So the fact that you're struggling with tests over clinical is a good thing. Did I just write a post about this? I feel like I just wrote a post about exams. Test anxiety or something. I don't know. I'm not a good test taker either. It's important to have very focused, specific studying. Figure out the way that you learn and do it. Like the teachers all have their own teaching style. You'll have your own learning style. Do you like to read? Do you like to listen to things? Do you like to explain things to other people? Figure out the way that you learn best so that you can apply that information the best. Don't cram. Plan your studying so you're not staring at a book the whole night before the test and not feeling great about it. It's important for you to okay, I have a test on Friday, so I'm going to study 2 hours each night for 20-minute blocks of time with a 10-minute break for 20 minutes break. I'm going to do that for 2 hours every night. I'm going to study this on this night, and this on this night, and this on this night, and then the night before I'm going to study for I'm going to do a quick review, and that's it. Having that mentality instead of I have a test on Friday, I'm going to study for 6 hours on Thursday, and 5 hours on Wednesday. That, too much information in nursing school for that to be an effective study strategy. So study appropriately. If you're not getting stuff, utilize your office hours with your professor. try to do whatever, if you suffer from anxiety or struggle with it, try to do whatever you can to decrease that, coping, whatever coping mechanisms you have. Meditation is great to kind of lower your anxiety threshold if you do that regularly, 10 minutes twice a day, that kind of thing. Oh wait, hold on, this is a longer one. Marissa's. Okay, my friend works at a large hospital in the ER, and they require yes, lots of other certifications. Wouldn't you agree that if a person wants to work in the ER, they should shadow? Do all units have certifications you need to uphold? Yes, if you want to work in the ER, you should shadow because it may not be for you, and that's a lot of work to put into something to just not do it anymore, I guess. You know what I mean? Like, I highly recommend shadowing if you want to do that. So if you can do that. So most med-surg units require, well, actually working in the hospital requires you to have a BLS usually. But ACLS, if you're working in the ICU, I had to get my ACLS and I had to get my NIST certification within a certain amount of time. Which, if you're an ICU nurse, you got to be ACLS, Advanced Cardiac Life Support. TNCC, she said here, as the trauma certification. PALS is the Pediatric Life Support. Various units will have various requirements and give you a certain amount of time to obtain those. So from the hospitals I worked at, I got the job first, and then they said, okay, you have this. Here, we offer these classes, take these, or get it by this time, or whatever. So that's what I did. So I have ACLS, BLS, NIST, and I have my CCRN. So, not all units require them. If you're going to work general med-surg, you're probably just going to need a BLS. But it looks great to have the ACLS, to have the additional ones, but it kind of really depends on the unit. But the ED, by far, needs the most certification. I think ED and flight nursing probably has the most. I'm a nurse in the ED, nurse tech in the ED while finishing nursing school. Wonderful. Had an interview for neurotrauma ICU. I think it went well. What do you suggest to brush up on besides neuromeds and neuroassessments? You will be, that's enough, neuromeds and neuroassessments, but also the anatomy, the vasculature of the brain, knowing the circle of Willis. That's really important because if a patient has an injury, trauma, or a stroke or whatever, to one area of the brain, what do you expect to see? I wouldn't understand vasospasms, the Monroe-Kelly doctrine, like those kinds of things. Cerebral perfusion pressure. Oh God, we should do one on all neuro. There's a lot of neuro things to know. But start there. That'll get you some of the way. All right, Natalie, studying hard. I did pre-nursing last year. Find nursing was a huge difference in work from pre-nursing. Time management is essential. Yeah, so the difference between like pre-nursing courses and nursing, other than everything, but you really cannot cram. You really can't just study the night before. You must have a plan for your studying. You cannot write a paper the night before. You can, but you will stress yourself out unnecessarily and probably not get as good of a grade. Honestly, you can. Just because you can do something doesn't mean you should do something. You should space out your time to study so you can understand the information. Nursing school is way too complex and too comprehensive for you to ever understand and comprehend all of that information. I had reading assignments over 400 pages. Like, I'm not going to memorize all that. I got to figure out a way to put this into manageable chunks to translate so I can field questions and not, like, the whole, like, okay, I'm going to try and memorize some points. Like, yeah, you're going to need to memorize a little bit, but just because you memorize something doesn't mean you understand it. So it's important that you understand concepts and not memorizing. Thank you. Oh, thank you so much. Woohoo! Thank you, Bailey. All right, here we go. Hopefully you guys don't stump me. Well, you guys have. There's been a couple questions I can't answer. For tricky test questions, look at application and interventions you can do for the patient. And if you can write on the test itself, underline keywords so you don't get stuck on the unimportant info in the question. Review your tests with your professor and see you went wrong. Caitlin, beautiful. I love it. I don't even feel like I need to add anything to it. Michelle, last one here, guys. Oh, just kidding. What jobs can nursing students apply for after their first semester? Thank you for all your advice. You are welcome. if you can be a CNA, I feel like that's one of the most valuable jobs that you can have as a or as a nursing student, because you just get exposed to the environment you're going to work in. And like I said, the only new grads that have been successful on my unit have been ones that were working there when they were in nursing school. They are learning things in school, and they are seeing us do those with patients. And they are, and even if it's not in the ICU environment, you're in some other, you're learning about things in school, you're physically seeing them. It's not like this theoretical thing, and then you go to clinical to hope to see it, and it's like wonderful if you can be a CNA in a hospital. Or not necessarily in a hospital, a CNA in whatever field of nursing you decide you want to go into. So that is a great one. Some people do EMT stuff. That's also great, but that's also like, I wouldn't do that while you were, like, if you already have that work as one. Hospice, like volunteering in hospice. I volunteered in nursing school. I volunteered in an emergency department, just like restocking lab trays and cleaning rooms. It was helpful because I could talk to other people there and get their opinions, and kind of building rapport and asking people what they think and what's this and tell me about this. So that was cool. Getting anything that can get you familiarized with the way a hospital runs, the culture of a hospital, the flow of it is really helpful. So whatever capacity that may be, if you can't get a job, try and volunteer. That can be really helpful and look wonderful on a resume. What else? Those are good jobs. Yeah. But, yeah, I don't know if I have any more. But CNA, if you can do CNA, that's the best one. Sarah, there you go. CNA or tech is a great way to learn prioritizing. And then Libra. Plus, I'm in accelerated programs. Yes, if you are in an accelerated program, that is challenging. Kudos to you. That's accelerated BSN programs are no joke. Brianna, I hope I said that right. Do you have, hold on. All right. Do you have any resources to practice critical thinking / best answer scenarios for a first-year student? I'm in my intro to nursing class. Our first midterm was completely NCLEX style, and I did poorly because I was expecting textbook style questions. Been there. I've been there. Our textbook is the Canadian Fundamentals of Nursing, if that helps. There are end of chapter questions, but they were nothing compared to the midterm exam, and I felt so unprepared. So don't be too hard on yourself. Understandable. So the NCLEX style questions are totally different than any other style of questions that you're probably getting in nursing or in school up until that point, because the style is so different. So things I recommend is getting an NCLEX resource are nursing practice questions. You can try it out for free, I think. I think we have that where you try it out for free a day. I don't know. But just getting used to this style of questions. When I started nursing school, it was great advice. The first thing they said in the first semester was get an NCLEX resource and start taking questions, because you got to get used to the style of those questions. I got so used to NCLEX style questions that whenever we took ATI, which a lot of you guys probably have experience with, I noticed a slight difference in the ATI style of question versus the NCLEX, Kaplan style of question. I noticed there was, ATI had a very specific style to them in my mind, as I got so used to taking them. So, understandable that you didn't do well because it's so different. So don't beat yourself up because it's totally different. How was anyone going to tell you about that? That is a big challenge. A lot of people have had that experience. So the sooner you can get used to understanding how the NCLEX is structured and the style of the questions, the better. One of the main things is, I'm going to give you 4 answers. Here's a question, here's A, B, C, and D. A, B, C, and D are all correct. Technically, they're all correct, but one of them is the most correct. Which is the frustrating thing, because I used to be like, oh, okay, this is the right answer. Circle, yay, I'm done. No. So that's one of the big things, and understanding those and select all that apply, those are tough too. So start getting used to it. Check out nursingpracticequestions.com, and I'm pretty sure we have an app too where you can just go do them on the go and just get used to them. Okay. Oh. Thank you for doing these videos. You're awesome. Yay, thank you. I'm in an accelerated BSN program. Oh, My condolences. Those are tough. And I feel like it's too much to learn in a 16-month period. Do you have any insight on how much is realistic normal to retain from such a fast-paced program? I've worked with people that have gone through accelerated programs, and they've done wonderful. It's a lot of information, but honestly, if you have another degree, and you really just need that nursing piece to it, and it is a lot to cram in. But the people that I have known that have gone the accelerated route have done just as great as others. And if this makes sense, they all ADN, BSN, accelerated BSN, we all graduated kind of knowing about the same, I felt like. And we all needed help after graduation. We all had knowledge deficits specific to what we were doing. So everybody's going to need a little bit of help. So it is really challenging. Accelerated programs are no joke. Like, that is your life. But I feel like, and actually John and Heather, two of our instructors, went to an accelerated program. So if you guys have any accelerated program specific advice, I don't have any off the top of my head, and I don't want to just like make things up. So I'll see if they can answer your question specifically, Rachel, because that is a little bit of a different learning style because you don't have time to do anything else, and it is just super fast-paced. Yeah, so we'll get back to you with something more specific because I don't feel like I have something substantial to tell you. Okay, Cheryl. We were told by our assistant DON, Director of Nursing, that we were doing our first clinical shadowing in shadowing the CNAs because we have to know what they do and how they do it. Because if we're going to be managing them, we have to know what their job is, and we must absolutely respect them much more after we have been in their shoes. Trust me, this is the truth. Okay, thank you, Cheryl, because I have met nurses that were not CNAs, and some of the ways that they delegated were clearly like, all right, you've never been a CNA before. Like, CNA work is super tough. Super tough. It's important to see what that's like. How can you delegate to people and not really understand what they're doing? It's almost like the physician that's putting in orders that has no idea what it takes to implement those orders. And how frustrated we get. Well, think about a CNA. It's like that's responsible for taking 20 people to the bathroom. It's not realistic to expect that person to just do that, and you don't think you have to do that. No, you're gonna have to do CNA work. And honestly, CNA is like, I can't get through a shift without a wonderful CNA. I mean, I could, but I wouldn't do as well. Like, I've had CNAs that have saved my butt, that have had patients that didn't look so good. Katie, you got to come in here and take a look at this guy. And it's like, holy crap, we're going to have to do whatever, get a blood pressure. Oh my gosh, they're hypotensive. Let's do this. Or, and you help them out, they'll help you out. When you're dying and you need help with this, they'll get you back, and you got to do the same with them. And it's really important to understand what they're doing, and they can teach. You can learn so much from CNAs, especially when you're a brand new nurse, especially when you don't have experience with patient care. You will learn so much from CNAs. So kudos to your DON for making you do that, because it's so valuable. Thank you for sharing that. ATI and HESI are similar. That's one of those things. I have no experience at all with HESI. None. Never took it. Didn't even know that word existed until a few years ago when I saw people on these sites talking about them. Y'all are lots of questions. All right. I'm about to begin third semester nursing program. Some nurses at clinicals recommended HESI. Do you have any experience? I just said I have no experience with it. So if anyone has any thing of value to add to Kimberly's question about HESI, please do, because I can't speak to it. All right. You and your videos have saved me during my critical care and ICU rotation. Yes. 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 Okay. My professor has even joined in and recommended your nursing book to everyone. Oh, yes. Can I ask if you could prep for the most important things for a first day of precepting in tele? Yay. Okay. Precepting. Okay, so make sure, if you don't already know this, how to put on a cardiac monitor. I pull these things out all the time. Oh, here it is. Perfect. I didn't want to have to try and find it. I know you can't get this for tomorrow, but we have a cheat sheet. You can print this off if you really wanted to, and I hope someone's still on here for our cardiac cheat sheet. So that shows where the leads go. So if you can remember that and be able to put that, it's going to be one of the really oh, I'm in tele, and they're all going to be on telemetry. They're all going to be on a heart monitor. So if you can know how to put the heart monitor on, always know the potassium of your patients and the magnesium. Potassium is more routinely ordered. Magnesium might not always be ordered because it doesn't come on a BMP. Like if they want the patient to have a magnesium drawn, they have to draw that specifically. So make sure you know the potassium of your patient. Make sure you know kind of their ins and outs. That's really good to know. Let's see. Always when you're on a report, getting a report on your tele patients, find out what their rhythm is. And then right after report, when you get there, they're a normal sinus rhythm. Go up to the monitor and check and make sure and print off your strip and interpret your tele strip at the beginning. I've had times where I get a report that the patient's in normal sinus rhythm, and then I go and I print off a tele strip and they're in AFib. When did they flip into AFib? You would think someone would notice that, but they may not. Maybe that they flipped into AFib after the telemonitor got through them, and so it's like, when did this happen? We got to look back through. When did they flip into AFib? So that would be really important to assess at the beginning, and I think that would make you look kind of good if you got a report and they're like, they're in normal sinus rhythm, and then that's the first thing you do is you go check to make sure they're in the right rhythm. Always know what there's you got to know a lot of stuff, but I'm just kind of picking apart a few important things. IVs. If you have a patient on tele, they must have an IV typically in the units you're in. That way, if you need to give emergent life-saving medications, you can do that. So when you're getting a report, making sure you know if your patient has a patent IV, that is good to go. So that's really good to know. Those are my top ones for tele. Yeah, okay. Good luck. And yay, I'm so glad that your professor likes my book. Hey guys, I'm writing another one. Well, I'm writing a second edition. So I have listened to the things that you guys said you wanted in it, and I'm adding more content, more stories. So it's going to be adding a bunch more. So it's going to be, and I'm going to structure it a little different. So if you bought the first copy, you might want to get another one because it's going to have a lot more in it. And I'm going to create workbooks to go through it so that you can go through the workbook and here's a patient scenario. What would you do? That kind of stuff. So I thought that might be helpful. So I'm starting to work on that now. All right, you guys. My school requires an 850 minimum on HESI in order to graduate. The green HESI book on Amazon is great. Oh, thank you, Ed, for putting that in there because I don't know anything about it. I don't even know what an 850. I don't know. CNA, first semester BSN. Tatiana, that's wonderful. Wonderful job. What is your book? I have 3 books, but the one that they're talking about is called Becoming Nursey. If you just Google, if you just Google Becoming Nursey, you can find Amazon will be the first one, and then Barnes & Noble is the second. $12. You can get it on Amazon Prime. It's just kind of my tips for nursing school and being a new nurse. The first section is nursing school, but most of it's about being a new nurse, but you can apply some of it to nursing school, and hope it's really helpful. I'll talk about my first code blue, the first time I cleaned up a patient in a nursing home. Whew, it was an intense experience. Kind of just tips and tricks and stuff. So I hope it's helpful. Jenny, thank you so much. And then for tele, 6-second EKG from Skillstat and Dubin's rapid interpretation are great. Ed, you're awesome. Thank you so much. Ms. Lizzie, I failed. Oh, I don't know what you're talking about. I'm sorry. Okay, guys. It's been almost an hour and a half. I'm tired. I will be back next week. Just so you guys know, next Tuesday at 8 p.m. Oh, okay. Wait, hold on. First semester performance exam, but I'll do better next time. Yes, you will do better because you'll know what to expect. You'll know what to study. Guys, if you're doing crappy at the beginning, it's okay because you're really just learning how to do nursing school. And nursing school is very different than the rest of college. So if you are frustrated at the beginning, you're just kind of figuring it out. It's like when you learn how to swim, or like, when you grab a basketball, you're not going to be friggin', Derrick Rose right away. Like it takes time to become good and to understand how how to, you know what I mean? It's like, it's not like the first time you get a basketball ever, you're going to do this wonderful layup. Like, it takes time to put you're mechanically learning how to do things, and then eventually it'll be a lot more fluid. So it's difficult and frustrating at the beginning, but you'll learn your learning style. You'll learn your teacher's teaching style. You'll learn NCLEX style questions, and eventually you'll put it all together and figure it out. So I hope this helps. Thank you guys so much for hanging out with me tonight. I am a go to bed at 9:30 kind of girl, and it is 9:26, so I'm going to finish my sparkling water, and I'm going to go to bed. So have a wonderful night tonight, and thank you guys so much for joining me.